Hey, Discern listeners, a lot of you have been asking me to talk about how Dr. K had his medical license reprimanded recently. So let's get into it. I have read the report that the state licensing board submitted, and also I have read the statements from Dr. K and Healthy Gamer, and I've watched some of the videos put out by Dr. K in which he talks about the situation. And one of the reasons why I want to talk about this today is that there seems to be a lot of confusion online as to what this means, with some people saying it's not that big of a deal, and other people saying that Dr. K should have his license removed, or they even think that this means that his license has been removed and he has been charged with a crime or something. So I thought we would get into it here. It makes sense that people are confused because it's pretty confusing if you're not in the profession. And I should say that I'm not a medical provider. Dr. K is a psychiatrist, and I live in the world of psychology and marriage and family therapy and counseling. But the ethical codes and the considerations are very, very similar. Now, some of you might not know who Dr. K is, so I thought I would just give you a quick primer here. Dr. K, and honestly, I don't know that much about him. I, of course, have watched some of his content, and people have referred a lot of his content to me over the years. And from what I've seen, he seems like he's on the up and up, a very respectable guy, doing a lot of really wonderful things in society, helping a lot of people. But I can't comment on everything he's done, obviously. So a little primer on him is that he is a psychiatrist, and he is on Twitch and on YouTube. He on YouTube has 2.5 million subscribers, so he's very, very popular. He graduated from Tufts University School of Medicine in 2014. He has been a licensed psychiatrist practicing medicine in Massachusetts since 2017. He is board certified in psychiatry, meaning that he has additional training and has passed additional testing. It's a major pain in the ass. Board certification in psychiatry is rough, and just getting the degree is rough. So he's been through a lot and proven himself to know what he's talking about. He also has a private practice, and he is the primary owner of Healthy Gamer GG, which I'm not exactly sure what the organization is in its entirety, but I know that they are making content, like Psychology in Seattle, for example. It's an organization. It's not just me. It's, there's employees and whatnot. So Healthy Gamer GG, I'm imagining, just a guess, that it started out as just him, and then as things became bigger, he incorporated and had employees and, all the kind of stuff. And in terms of how Healthy Gamer advertises itself, quote, "It is a mental health platform that provides content like YouTube and Twitch stuff, but they also provide coaching and community resources to help young people take control of their mental health and their lives." So it's not just content provision, but it's also providing coaching and community resources. Community resources, I'm guessing classes or helpful handouts, I'm guessing, I don't know, tools. From my understanding, Healthy Gamer, the organization, has a number of coaches under their employment that when people reach out to Dr. K or Healthy Gamer, they are referred to these coaches, I'm guessing. Now, of course, coaching is not a clinical service in the least, so I have some thoughts on that, of course. But if coaching is provided in a responsible way, it can be a wonderful service for people. All right, so let's get into the licensing board complaint and report. And I should say at the outset that I'm not a scholar in this topic. There are people who know a lot more about this. The thing that I can offer is my own professional opinion. I also consider myself to be an expert not only in ethics, but also in the provision of online content by clinicians. I have been a podcaster and a YouTuber for 16 years and have made it my responsibility to make sure that I am following the ethical codes and am following the law and not harming my clients or the public or my own students or supervisees. So there's that. Also, as a supervisor, I not only had to supervise my supervisees in terms of their clinical work, but I also had to make sure that they were following the ethical codes, and that means I need to understand them forwards and backwards. Also, I took it upon myself to write a white paper on clinicians using social media to provide content. I wanted to comb through the literature and the research. You can find that white paper on my website. So when I comment, I am commenting mainly from that place, but my knowledge of the details of this story is limited because I haven't watched that content. I considered watching it all, but it would have taken me weeks to go through it. There's just too much. So I'll just say that from the outset. All right. So what happened? Well, this is all from the report from the licensing board, by the way. There might be additional details, but these are the relevant details. This is the result of the investigation. And I appreciate the licensing board's report. Some of these reports can be quite poorly written, but this one was clear and understandable. So in December of 2019, Dr. K interviewed someone by the name of Reckful. That's their online name. Their actual name is Byron Bernstein. And Reckful, we'll refer to him as Reckful moving forward because that's the way everyone knows him. He was a prominent Twitch streamer, particularly for playing World of Warcraft, is my understanding. So Dr. K interviewed Reckful for about 2 hours on a Twitch live stream in December of 2019. And they talked about depression, bipolar, suicide, and psilocybin. It was a 2-hour long conversation, so there's a lot of things happening. During that conversation, Dr. K acknowledged that his colleagues worried that he could be sued if someone on his stream died by suicide. Also, Dr. K offered Reckful to reach out to Dr. K if Reckful had thoughts of killing himself. So it sounds like in this first interview, this first online discussion, it's not a session, it's not clinical, officially anyway. They talked about his depression, his bipolar, his suicidal thoughts, and Dr. K said, hey, if you ever are thinking about killing yourself, feel free to reach out to me. All right, so let me talk about providing therapy during a live stream or providing clinical psychiatric services over a live stream. Contrary to what a lot of people think, there is a way to provide clinical services during a live stream in an ethical and legal manner. Clinicians have been doing this sort of thing for decades, prior to the internet even. There's a famous set of films by Carl Rogers and Fritz Perls and Albert Ellis. The slang title is the Gloria tapes, but these were therapy sessions that were recorded, filmed, actual film, and published. And, so we've been doing this for a long time. The reason why we do this sort of thing is so that we can educate clinicians that are in training or current clinicians. Also, it's a way to get the word out to the public as to what therapy might look like, or there might be principles or lessons that are learned in the session that the public can benefit from. That's always the way that we think about ethical decision making. It's not do this and don't do that. It's given every situation, is the benefit enough that it justifies taking the risk? If we avoid all risks, then we wouldn't be able to do much beyond a very narrow band of behaviors. But sometimes we want to go outside of that a little bit while considering, is there enough benefit to justify the risk here? And that's how we make those decisions. So for someone like Dr. K to have a talk with Reckful during a live stream that might look kind of like therapy, there's a risk there, right? Reckful might think of it as therapy, even though you might be very clear to Reckful, and from my understanding, Dr. K was. He would tell people this is not therapy, just so you understand. Also, the audience might think of it as therapy and think that it's okay to live stream therapy, which could be harmful to the public, could be harmful to our profession. So is the benefit enough that justifies taking those risks and other risks? Well, I don't know specifically, but often there is a benefit as long as you take the proper precautions, because from my understanding, Dr. K does a lot of good in the world. A lot of people watch these live streams or these videos and learn things about themselves and are made to feel validated about their own emotions, even though they're not involved in the conversation. And that's incredibly helpful. Also, some people might see it and go, oh, maybe I should get a therapist. There's a lot of benefits to it. I don't know specifically about this particular discussion, but, that's the way that we think in our field. And I should say that I've thought about doing this over my 16 years, but I've just never had the time to look into it, to look into how to do it ethically. And I also, I don't know, it's just not high on my priority list, really. But if I had 10 clones of myself, one of them would be doing this sort of thing. The other thing worth pointing out is that just because you have a psychiatrist or a clinician who is talking on the internet, live stream, with someone about their depression and their thoughts of suicide, that doesn't mean that it is a clinical service. For example, for myself, if a friend were to come to me, this isn't online, if they were to come to me and they were to tell me about how they have PTSD or they have some sort of reaction to something, and I'm like, it kind of sounds like PTSD or something like, and then they say, well, what do you mean? And I say, well, tell me more about this. And okay, that sounds like a symptom of PTSD. As long as I am not crossing the line into treatment and I'm clear to my friend that this is not a replacement for treatment and I'm not providing treatment to them right now, I'm also not diagnosing them right now because that is not considered ethical. I might say something, and I recently said this to a friend after having a long conversation, that I'm guessing that if they were evaluated, they would be diagnosed with the following, But I said, I can't know if that's what's going to happen or not. You're just going to have to go to a clinician and be properly treated and assessed. But also, if we were to periodically, like once a week for an hour, talk about their issues, even if I said, hey, this isn't therapy, it's starting to look like therapy, generally speaking, in terms of the way I described it, that should be something we should steer away from. Now, the reason for all this isn't that we just have this rule about boundaries. It's because we're concerned about harming people. We don't want to risk harming people. Is it necessarily true that I'm going to harm someone if I did that, if I met periodically with a friend about their PTSD? Not necessarily. It's not guaranteed that I'm going to harm them, but the harm is greater, and it's not justified because there are plenty of clinicians out there who would be able to help them. Now, what would be the harm? Well, as their friend, I would lose objectivity. We could never be fully objective with anybody, but as their friend, I know their part. If they were to complain to me about their spouse, and that spouse is maybe even a closer friend than the person talking to me, then I have a conflict of interest. And I could go down a long road of all the various things that could happen when we have these multiple relationships. But suffice it to say, it's harm that we're concerned about, not following a particular rule. Okay, so let's get back to the report. So there was that first meeting in December 2019 in which they talked about depression, suicide. The same month, December 2019, Dr. K and Reckful live streamed an interview that was 1 hour and 20 minutes long. They talked about Reckful's history with therapy, among other things. Dr. K also suggested that he and Reckful meet every week for 4 to 8 weeks to address his loneliness. So it's starting to kind of sound like treatment. I don't know if this is one of the things that Dr. K would look back on and say, I don't know if I would word it like that or do that these days. I don't know. All right, so January, the next month in 2020, Dr. K and Reckful connected for a third live-streamed interview that lasted over 2 hours, in which they talked about depression, Reckful's brother's suicide, and also psychedelics. So it's just a continuation of conversation. January 2020, another meeting, 1 hour and 50 minutes. They talk about borderline personality disorder in addition to other things. Dr. K in this meeting stated that he would try to love Reckful for 2 years. So this, taken out of context, for some might sound very strange, possibly unethical, that you have a psychiatrist, a clinician that's providing counseling services, that he would say, I'm going to try to love you as my friend or as this coaching client, or it's unclear what exactly the role was there. It sounds like, from the description anyway, that that's in response to the borderline personality. So let me very briefly talk about this topic. So for experts in borderline and in a lot of personality disorders and in ancillary kinds of issues, it can be very helpful if the therapist provides what we call a corrective experience. We use our relationship in therapy as a helpful mechanism for the client. For example, with people with borderline personality disorder, often their trauma is that they were abandoned and or betrayed severely and repetitively, abusively growing up. And a part of their issues and their symptoms, their behaviors, their emotional issues stem from this belief that they are always going to be abandoned and they're always going to be betrayed and no one's ever going to love them. And as therapists, we might see it that way. There's different ways of looking at it, but that's the way that experts will see it, such as myself. And when we're trying to help a client to believe that other people can be trusted, not everybody, but some people, it can be really hard for us to convince them of that when they are in relationships outside of the office and things don't always go well, oftentimes because they are misinterpreting other people's behavior. So we can use the relationship in therapy because, at least for myself, when I'm treating someone with borderline, I know what I'm thinking and feeling, or generally speaking. And if the client were to interpret my behavior as abandoning or secretly hateful of them, which can often be the case, I can be right there and say, no, that's not what I'm thinking, and I can prove it to them. Whereas if they come into the session and they say, so-and-so, I know they secretly hate me because this is, I don't know, maybe that person does secretly hate them, but I do know that I don't hate them, and I do know that I can make up for it, and I'm trained, and I have, consultants and a lot of experience navigating those waters. And so through that relationship, they can have a corrective experience where they can have at least one relationship where they could say, okay, maybe I am lovable, maybe I can trust other people, and they can use that as a jumping off platform to expand their other relationships that can also be positive, so they can start to get their needs met, essentially, and also change the way that they react. Their emotional reactivity will be different. A lot of things begin with that corrective experience. So when you have someone like Dr. K, and you can do this as a friend as well, a colleague, right? Like with people that listen to my audio podcast with my co-host Bob, there are times on the microphone and off the mic, mostly off, where we will talk explicitly about how I am providing him a corrective experience by showing him that he's worth love and he matters in the world. And I'm not his therapist, I'm his best friend. But because we're both shrinks, we frame it in that clinical language, and we're mindful of it, we're intentional about it. I'm not providing him treatment, so Dr. K could, if it was done right and there were the proper parameters, Dr. K could try to love Reckful for 2 years to prove to him that Reckful is lovable. I don't know if that was what was happening, but on the brief description, given that they were talking about borderline, I'm guessing that's what was happening. The question I have, though, is how much training and experience does Dr. K have with this form of therapy? Because it's very complicated and it has a lot of risks to it, obviously. But let's move on here. All right, so moving forward to the 5th live stream, it was the same month, January 2020. This interview lasted for almost 2 hours. And in this interview, they talked about their last interview. And they talked about the nature of their relationship, whether or not Dr. K was Reckful's therapist or friend or what. And later in the video, Reckful told Dr. K that he remained conflicted about the status of the definition of their relationship, meaning that Reckful was like, I still don't really understand what we are with each other. Also, Dr. K acknowledged that his very bold claim about loving Reckful for the next 2 years was irresponsible. So remember, he says in the last, he's like, I'm going to love you for 2 years as I think a therapeutic or a helpful thing. And Dr. K said, that was irresponsible. I shouldn't have said that. It kind of sounds like Dr. K in the previous live stream. I can't know this, but it sounds like Dr. K got taken up in the moment and really cared about Reckful, really wanted to help, and knew or thought that if he could prove to Reckful that someone could love him, that would be helpful to Reckful. Just a guess. And then later, Dr. K said to himself, I don't know if I have the time or the role or whatever to do that. And although I wanted to do it, I can't do that. So it was irresponsible. It's just my guess as to what was happening. So I'm guessing that this is what the licensing board was focusing on when they were making their determination about the reprimand to the license. I don't know that, but this description in the licensing board report, it reads to me as this was when things went wrong. All right, February 2020, the sixth and final live stream interview happened, and it was about 40 minutes. So it's a shorter amount of time. I don't know, but maybe Dr. K was like, I need to extract myself or something, or I need to refer Reckful to an actual clinician, and I need to take a step back, or I need to transition Reckful into clinical services, which means we can't be live streaming it. I don't know. I don't know what was happening, but it was a 40-minute. It was their final one. And in this video, Reckful mentioned that he and Dr. K would continue their conversations offline. So Reckful's like, well, we'll talk about this later. So I don't know, but the way that it reads, it's possible, which would have been okay if the proper precautions were taken, that either Dr. K and Reckful transitioned from live streaming relationship between colleagues or friends or whatever to either a psychiatric counseling relationship or maybe a coaching relationship. I don't know. I read somewhere that Reckful doesn't live in Massachusetts because that's where Dr. K is licensed. So he couldn't have treated Reckful as a patient. The details weren't in the official records as to where they lived or what was being done. But Dr. K has said repeatedly in his response videos to the licensing board decision that he's not going to talk about a lot of the details of this case because he needs to uphold confidentiality. Typically, we don't use that word unless we're talking about a professional relationship. So was there a professional relationship? It kind of sounds like that way to me. Just speculative, but it sounds like Dr. K transitioned Reckful to become a client, a patient. I don't know, but it's possible. Could that have been done in an ethical way? Yes. It depends. There's a lot of gray area. I would have to know a lot more details. But we do know that the licensing board did not focus on that. They didn't reprimand him for his relationship with Reckful offline. That wasn't a question, which seems to mean that when they did learn the details, they were okay with the way Dr. K was with Reckful offline. But it's possible that since the complaint didn't focus on that, the licensing board didn't focus on it. But I don't know. I don't know. All right, so moving forward in the report, they detail that in June, so remember we were in December, January, February, but now we're in June 2020, and Reckful's friend reached out to Dr. K to discuss that Reckful had declining mental health. I don't know what that means, but given the fact that Reckful died from suicide, the next month probably had something to do with that. So it's a very sad outcome that Reckful died by suicide. Might there have been something that people could have done to prevent this? I don't know. But I will say that when someone dies by suicide, often the people that care about the person who died, they will look for a scapegoat. Not always, but often. And some of the times that is justified. Sometimes there is someone to blame. But oftentimes there isn't anyone to blame. And I wonder if, Dr. K kind of got wrapped up in that. I can't know, but I just wonder about that. So the question would be regarding the suicide, and this is not the question regarding the licensing board report, but a lot of the online discussions were along the lines of whether or not Dr. K contributed to the death of Reckful or didn't do enough to prevent it or something like that. And we just don't know, and we'll probably never know. The three possibilities are that Dr. K actually was a contributor to the motivation of Reckful to attempt and complete suicide. The other possibility is that Dr. K actually did a lot to prevent Reckful from dying by suicide. Without Dr. K's help, Reckful might have died earlier, right? The other possibility is that Dr. K had nothing to do with the timeline regarding Reckful's death by suicide. That's probably the most likely, given my anecdotal experience with cases that look like this, but we just can't know. And I'm not hearing anything in the description or even in the online allegations and discussions. I'm not hearing anything that makes me believe, oh, wait, maybe Dr. K did do something that was irresponsible, like exploited him online, maybe trying to amp up his depressive symptoms or his suicidality, maybe not really addressing his suicidality because it makes good content. There was nothing, I didn't hear any data to support that. If anything, it was the opposite, right? So to consider Dr. K without any information as someone you can blame for Reckful dying by suicide, it seems like looking for someone to blame. So after Reckful died by suicide, someone complained to the state of Massachusetts State Licensing Board, and then a 2-year investigation took place, which culminated in a decision that was made very recently, just a few days ago, from the time I'm recording this. So let's go over the conclusions in the report. So the conclusion was that Dr. K, quote, has engaged in conduct that undermines the public confidence in the integrity of the medical profession. So let's break this down. He has engaged in conduct, these online live streams with Reckful, that undermined the public confidence in the integrity of the medical profession. So what does that mean? Well, it's a category of ethical codes that is very amorphous. I have looked into this a lot. When I was writing my white paper on the provision of social media content, YouTube content by clinicians, this is the one section of my paper where I discussed how the notion of unprofessional conduct is so amorphous. And when you read different experts and you read different authors and you read different guidelines, it's all over the board. There's a lot of range regarding what people consider to be undermining the public confidence in the integrity of the medical profession or the professions in mental health. But we would assume that the board were very careful about how they implemented that, and 2 years of it. Plus, Dr. K agrees with this. Dr. K says, "Yeah, I agree with what they're saying." Basically, Dr. K hasn't said this directly, but he has said he agreed with the conclusions, which means that Dr. K agrees that he did undermine the public confidence in the integrity of the medical profession. They did not go into detail at all in the report, and I've looked all over. There is no public statement as to what exactly they are pointing to. But given the fact that they are, just before this, the only facts that they detail are those 6 meetings, and they do not point to the suicide, they just mention it, right? But what they're pointing to, I believe, is that what Dr. K was doing is he was having these meetings with Reckful regardless of the suicide. The suicide just, I guess, highlights it or prompted the complaint to begin with. But anyway, maybe particularly the meeting in which Reckful was saying, "I don't understand our relationship." And the fact that Dr. K said, "I'm going to love you," and then later was like, "I don't know what to say." And there was confusion. So they did not find that his relationship with Reckful was a problem. What they did find was that he was representing to the audience. He was to the viewers. And the harm was to the medical profession, not to Reckful, not to the public, but the harm was to the profession. And when you harm the profession in the eyes of the public, you give the public reasons to avoid you as a profession, which can harm the public. That's the idea. So that's what they found. And they also did not tell him he had to take any content down, which leads me to believe that they think that the content is okay as long as he does things to explain, or maybe the disclaimers in the description of the episodes are clear or something. So they're not saying that episode is unethical. They're just saying, look, you're doing things, or you did a thing 4 years ago that undermines the public confidence in our profession. I'm guessing, this is just a guess, is that they probably said you should have been way more clear, especially in that one meeting. Maybe you have an addendum at the end or something clear in the description that very thoroughly addresses the nature of the relationship between you and Reckful. They're saying that relationship was fine and you didn't do anything wrong, but you weren't clear to the public regarding what the relationship was. And the reason why I'm speculating in this way is because I saw a lot of speculation online that didn't match up what was in the report. People saying that they were reprimanding him for boundary violations or something like that. It doesn't sound that way to me, particularly because they did not say he engaged in conduct that blurred boundaries. They didn't say that. They clearly investigated it pretty thoroughly. If they found that, they would have said it, and they didn't say that. Now, I will say that with my supervisees, I will have long conversations with them about professionality. So I don't take it lightly, but I don't consider it even close to actual harm of clients or actually contributing to the suicide of someone. I don't know. It's just priorities that I have. Other people could have different priorities, I guess. So because of this, his license was reprimanded. Okay, what does reprimand mean? Well, reprimand is a formal disciplinary action against someone's license, and it involves a number of things. So number one, the reprimand becomes a part of Dr. K's permanent record. In those movies from the 80s, it's like, it's going to be on your permanent record. Well, this is what they're talking about. It will be publicly available. If someone were to look up his license and go to the Massachusetts State Licensing page and look up his license, there will be a notation of this reprimand, which, isn't great. It can be humiliating to have something like that. Having said that, most people don't seek out this information. So I'm guessing the vast majority of anyone who would care, like a patient, won't even know this is out there because they don't even look. They might not even know where to look, that sort of thing. If he were not a career online personality and had to apply to hospitals or practices or whatever, this would be a concern for him, because when he applies, he probably would have to disclose that. There often is a check for this sort of thing, and he would have to explain himself. I'm guessing most potential employers would not think this was that big of a deal, particularly if he showed that he agreed with it and was doing everything he could to correct that. The other thing is that the reprimand serves as a formal warning, meaning, hey, we'll give you a second chance, but if you do this again, no. The third aspect of the reprimand is that it's kind of like probation, in that if you commit another violation, the disciplinary action might be more severe than it would have been otherwise. So that's another aspect of the reprimand. Also, the reprimand has no effect on his practice, and there are no fines. So it's a, hey, don't do this again. This will be on your public record and might affect you negatively. So don't forget it. Don't ever do this again. And if you do this again, then we're really going to come after you. But you're totally fine. So typically, and I don't know about the Massachusetts Medical Licensing Board, but typically reprimands are near the lowest of the reactions from a licensing board. there are things that they could have done that they didn't do. They could have said, you need to go to training, or you need to be supervised, or we're going to revoke your license for the next 6 months, or we're going to revisit this in 6 months to review how you've been doing. There was nothing like that, which seems to indicate that the licensing board was concerned, but not that concerned. That's the way I read it. So let's go over Dr. K's response. In summary, again, he did not contest the decision. This stands in sharp contrast to Jordan Peterson and how he responded to the Canadian licensing board telling him that he needed to take a class on using social media. This was in response to a number of tweets that he made that were highly problematic, including one in which he tweeted, remember, so he's referring to Elliot Page and how Elliot Page is a trans man. And he tweeted, remember when pride was a sin and Ellen Page just had her breasts removed by a criminal physician? So there's so many things wrong with this. It's massively transphobic. And also accusing a fellow physician of a crime without any data, using his massive platform to implicate or accuse a fellow physician of a crime when that physician was following the standard of practice. For Jordan Peterson and the licensing board to say, hey, if you want a license in our province, you need to go to a class. And Jordan Peterson flipped the fuck out because they asked him to go to a class. And he's like, free speech. It's not free speech. It's not a free speech issue. Yes, free speech is this is about you being a clinician. When we as the government say that you are licensed in this jurisdiction to provide clinical services to our citizens, we are endorsing you, and we can't endorse you if you're going to be doing this stuff, because if you're doing this stuff, what else is going on in your head? And patients, what if a trans person comes to you, okay? We can't sign up in the same way that the government says you are licensed to drive a car. If you violate that in a significant way, they will say, hey, you need to take a class on how to drive, or else we're going to take that license away from you. That's reasonable, right? That's protecting the public. That's why we have these licenses. That's why the Massachusetts State Licensing Board said, hey, Dr. K, if you're going to do this kind of stuff, you're going to have to tighten this up a bit. And if you do that, then okay. If you don't, then we're going to take away you can still make content on the internet, of course, in all likelihood, but we are endorsing you as the government, saying it's okay for you to provide treatment. It has nothing to do with it has to do with his treatment of his patients, right? So just contrasting Dr. K with Jordan Peterson. I mean, just think about it. Dr. K is like, yep, I agree with it. It's eye-opening. I'm already implementing a lot of changes. It's humbling. Thank you so much. I mean, just think about that. And I also have a bunch more in my notes here, but I think I've already been over that. So that's the long and the short of it. And let me know what you think in the comments. And if you also wanted me to maybe watch the live stream in question, let me know. Or if I got anything wrong, let me know. Or if Dr. K, you want to chat off the record or on the record, let me know. And regardless, everybody, please take care of yourself because you deserve it. You really, really do.